Hi, everybody. Today we're going to be diving into something that many of you may be interested in, and that is Botox. Yes, I will be taking you along with me as I go to the clinic. I've been going to for years, and I'll take you through my personal Botox experience. I'll show you the process from start to finish and whether Botox is something that you're considering, or if it's just something that you're curious about, then this video is for you. I do have to mention that there are needles involved and injections are being done in what you're about to see. So if those types of things make you a little bit queasy, maybe skip this video. And the best part is that Shawn Solomon at Thornhill Skin Clinic, someone I've been going to for years and I trust her so much, will be giving her professional advice. She'll share expert tips and tricks and insider information. She's so knowledgeable and just so amazing. You're gonna love her. I know you are. A professional of 30 years. She's so knowledgeable and amazing, and I trust her implicitly. Will be doing the procedure from start to finish and talking about what she's doing and also answering some very common questions about Botox, like, should I even get Botox? How often should I get Botox? What is baby Botox? How to pick an injector? All of the questions that you may have, she answers. And so grab your favorite coffee or tea, get comfy, and let's go on this Botox journey together. Hi everyone, so I've just arrived at the clinic. I am way overdue for my Botox. I can't wait. I'm probably 6 weeks too late. But anyway, it's never too late. Here we are. Let me take you inside. All right. It's a beautiful place inside too. Hi, good morning, ladies.
Nice to see you. You're here for your appointment?
Yes, I am.
Wonderful. We'll take
I
you in.
can't wait. Thanks so much. Ooh, this is all the stuff that's going in my face. So this is my very good friend and the best injector in the whole wide world is Shawn Solomon at Thornhill Skin Clinic, and I am so way overdue for my Botox, right? I'm like 6 weeks late.
It's all personal. But
All right, so Shawn's gonna inject my face with Botox, but she's gonna talk us through what she's doing, why she's doing it, and all of that.
absolutely. The first thing that we're going to do is we're going to assess Rhoda. Even though she's had Botox a bazillion times, every single time we see her, we reassess her muscles and her anatomy because things do change. They don't just change with age and time. It changes from the standpoint that we've had reasonably frequent Botox, so her muscles can get weaker or require less Botox, or even in some cases more, but that is extremely rare. So we're just going to take a look. Okay?
Awesome.
Okay, Rhoda, so get angry for me. Good, perfect. So we're looking at the muscle in between her brows here, which is called the glabella, or otherwise known as the 11s. Lift as hard as you can. Excellent. And we're going to close and squeeze tight. Good. And relax. And we're going to get you to purse your lips for me. Good. Now in her forehead, I'm going to get you to lift again. Lift again. So Rhoda has a lot of dynamic lines, but not a lot of movement. So in fact, the dosing of Botox depends on anatomy and strength of muscle, not how many lines you have. In the past, we used to do a lot higher of a dose in her forehead, but because we reduced mobility too much, it would reduce the space and size of her eye. We didn't like that. So believe it or not, in her forehead, we're literally doing 3 units. Now it might look like I'm injecting more because I microdose it across. Now that is an extraordinarily low dose. That is not the average norm, but understanding that some people can have 3 units and some people can have 20 units and the outcome can be exactly the same is very important for you to identify so that you don't go somewhere and say, well, my friend had 3 units. It really doesn't matter for you. So Rhoda came in with just a little bit of makeup on her beautiful face. So we're gonna use some alcohol to clean it off and make sure her area is clean and sterile.
Would you recommend that people don't wear makeup when they come?
Well, it's just easier for us. I mean, like at the end of the day, people are coming at all hours of the day. So I'm not going to tell people to go home, wash their face, and come with no makeup on when they're working and doing different things. But if you come without it, it's just a bit easier for the injector. We're also going to mark the areas that we're treating. so that we can have very precise injection points. Handy little eye makeup pencil. Okay, so what I'm essentially marking off is her canthus lines. I'm gonna get you to lift, 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 where her muscles elevate and depress to make sure that I'm able to get the best lift around her eyes. Lift, lift, lift. And again, these injection points can be different for everyone. They're not specific. This is a customized treatment. This area is actually called the DAO. It's one of the favorites for post 40. What it does is the corners of our mouth start to come down because our platysma bands, which is the muscle in our neck, starts to pull downwards, and then we start to look a little bit frowny and angry. So by triggering that muscle with a minute amount of Botox, we can flip those corners up and make you feel very fresh.
I love that part.
Me too. Smile big for me. Good and relax. We're also going to put a tiny bit of Botox into Rhoda's jawline. And the benefit of this is actually counterintuitive. By softly reducing this muscle girth, it forces the zygomatic muscle, which is your cheek, to work harder and lifts everything up and gives you a snatched jaw. Now, this is patient specific, but she's an excellent candidate and you will definitely notice a great difference from it. So now, one piece of advice I can give all you brand new potential Botox users or neurotoxin users. There are other neurotoxins on the market like Dysport and Xeomin that are all viable neuromodulators. I prefer Botox, but there's tons of people who love Dysport, and so there's nothing wrong with whatever choice you make. But when you go into a clinic and the needles are pre-drawn and you don't see the product being used, this should be a red flag for you. Every treatment and every dosing should be customizable to you as the patient. So if they're pre-drawn, I'm not sure what that is suggesting. The second caveat to that is these needles are 30 cc needles, but if you notice, I don't know if you can see this, but this one looks fuller because it's treated by the area, and this one's a little emptier. So the reason that I do that is because these are BD needles. They're really not used for multiple injections, so they get depreciated with each injection. So they get less sharp and less comfortable, more risk of bruising. So by dosing it down, I'm giving her a better chance for a comfortable treatment or a more comfortable treatment and less risk of dermal damage. Okay, so consider that from a standpoint that you want your treatment customized. You don't want to go in and they are just ready for you and one size fits all.
Those are good tips, Shawn.
Thanks. I mean, there's so many things out there. You know, we get all the time, is this place is cheaper than that place.
Yeah.
I always want you to consider that people use different reconstitution dilutions for their Botox, and it doesn't mean that you're getting exactly what you think. An average pricing for Botox or a neuromodulator that seems reasonable is anywhere between $10 and $13 a unit. Anything less should be something that you do question.
We should say that's in Canadian dollars.
That's in Canadian dollars. I don't know the Americans, but I know from state to state it's different. Actually, we were looking at this yesterday, weirdly. It can be very different. I know New York, it is excruciating that we have patients that fly here from New York because they can't afford to do it there.
Wow.
Yeah, it's true.
Really?
Yep.
Oh, wow.
Get angry, and relax. Good. So I'm going to make the first injection. And this is a deep injection. Each area actually requires, some require deeper, and some require more superficial based on the muscle and the density. Angry. Good girl, and relax. So this is going to take care of that furrow, because nobody should know if you're angry, especially your children. Get angry again. And relax. This one's a little bit more superficial. I know you can't see, so I'm just going to tell you. And this is one of my favorites for Rhoda, because by injecting just here below the brow, inside the corner of the glabellus, it's gonna make everything lift up. And again, what Rhoda's probably feeling, and she can tell you better than I can, is a little bit of a sting.
Yeah, that's it. Very slight.
Now, my best recommendations on how you pick your injector, angry again, and relax. I really feel that you want somebody who's been injecting for a minimum of 3 to 5 years full time. They have already gone through all the growing pains, because no matter how educated or how many courses they've taken, it really is user. So we see what happens. We understand how the different anatomies work with the doses that we're trained in. And with that, we get to better understand the anatomy. So you can have all the education in the world, but the hands-on experience really gives you your lifeline.
And different anatomies, right? Yeah. Everything is different. You customize to
for
everyone's
every single
needs.
Person. And every ethnicity has a different ideology of beauty as well. So those are different things to consider.
Yeah, for sure.
Okay, we're gonna lift, good and relax. So these, as I said, just 3 units, but these are micro doses. So I'm putting little superficial, tiny injections. And for some people, depending on anatomy and need, I'll go a little bit deeper. It really depends on the patient. Lift, good and relax. Our goal is not sometimes there's times when we want to freeze it up, but most of the time it's not. Most of the time we want to soften the way we lift to decrease the mobility of the lines and make things look fresher the way they did when we were younger, but not to take away animation and intonation.
Mm-hmm.
Lift, good and relax. And something I get asked, especially from new users, is, oh, am I going to bruise? Lift, relax. It is very possible. Bruising with Botox is usually pinpoint injury, just little tiny bruises, if at all. Right now, I can tell you I didn't bruise Rhoda. I can tell right off the bat because of experience and that I didn't hit any vessels. Yeah. But statistically, you have to plan for some bruising and potentially some mild downtime that really shouldn't affect your day-to-day.
Yeah, I've had bruising very rarely.
It happens.
I think the last time I had one, right, do you remember?
Yeah,
and you're like, oh shit, I hit a
little vessel.
I hit a vessel. Yeah.
It's essentially blind. I can't, if I can see it, I can avoid it. If I can't see it, well,
yeah, exactly.
Lift. Okay.
But it was fine, and it didn't last long, and it wasn't like a very dark bruise. No. Like it was just.
But it can be
very mild. Yeah.
Okay, I'm gonna get you to close your eyes and squeeze tight. Good, and relax. So this is a really lovely injection in the orbicularis oris. Say that fast. This one, people call this a brow lift, but essentially it's actually a lid lift. And what it does is it stimulates the muscle. Any depressor muscle when injected should lift, and any elevator muscle when injected should depress. So the goal is to bring this up and reduce the little fold around the eyes, and it can give you about 1/8 of an inch, but it is actually very remarkable when done properly.
I can tell the difference.
Yeah. Oh, relax. That's when I know I need my Botox.
That's when I know I need my Botox. I always say my face is falling, but really it's my lids.
They just make you feel and look tired.
Yeah.
And we don't have to look that way anymore.
They just look heavy, you know?
I completely understand. Yeah. When people ask me, is it time for me to get Botox? I always say to them, it's personal. You don't have to have Botox. These are personal things. Prevention is much easier than treatment. So starting young enough, don't fall into the theory of baby Botox. There really isn't such a thing. Mm-hmm. Baby Botox means micro doses of superficial Botox. It will not last. It will still be costly, and you'll be very disappointed. Prevention is injecting the muscles appropriately in the areas. You can go lighter, but baby Botox really
not a thing.
Well,
I mean, it's a thing.
It'll be disappointing.
Okay, so educational.
Well, that's what I do. Close and squeeze tight, so you can get a nice see of that sphincter muscle right around the eye. We're going to just superficially inject that little tail. Couple little points to lift that lid up so Rhoda can feel her beautiful self. Mm-hmm. Close and squeeze tight. If you don't trust the person who's injecting you, don't go to them. You can't know better than somebody who's putting needles in your face. There are some areas you can't inject without other areas. There are some areas that shouldn't be injected at all. You don't chase wrinkles with Botox. It's treating the muscle, not the wrinkle. The wrinkle is a secondary benefit of the injection. So you got to go somewhere you feel comfortable and confident. Okay. But I understand, because what happens is people go onto TikTok and YouTube because they want to educate themselves to have the best chance of having a really good injection. So I understand it, but mm-hmm. These are opinion-based facts. You really do need to trust your professional. And if you don't feel that you trust them, just don't do it.
Right. Yeah.
Okay, I'm going to get you to frown again. Good and relax. So we're doing this DAO. This is a really superficial muscle and needs to be extremely precise for it to work and for it to be safe. Perfect. And now we do a little along her jawline. This can smart a little bit.
Mm-hmm.
because it's really superficial and there's a lot of little nerves here. And that is a thing. Like there's different areas of the face that require.
Yeah, this part is not fun.
Be friend with your mouth. Good, and relax. So we're not going to move at all. I actually want to see the tip of my needle. Beautiful. See, it's normal to see little bumps in the skin because I'm putting it so superficially.
How long have we known each other, Shawn?
We have known each other 31 years.
Yeah.
We met each other through a friend. I actually found a picture that I gave to Rhoda from a friend of ours' daughter's. I think it was her christening or baptism. I can't remember.
Oh, yes.
Right?
Yes,
and I found a picture of Rhoda holding my daughter, who at the time was 3 years old, and she's now 31.
Yeah.
So, cleaning off the little markings I made and any little blood droplets. And generally, if you don't get a bruise, when you walk out, you may have a little bit of redness from injection site, but that usually lasts about 15 minutes. You should not post-procedurally rub the area, massage. You should not lie down for a minimum 4 hours. You should not work out for 24 hours. You should not drink alcohol for 24 hours. You should not take any NSAIDs like Advil or ibuprofen because they increase the risk of bruising because they're blood thinners. But really, other than those are all small things. Oh, heat-inducing activities like jacuzzi, sauna, whirlpool, hot tub. This can interfere with the mastification process, so it can reduce your effective Botox. And there's also a new study over the last couple of years that you should not have your Botox within 2 weeks of any vaccine. That's not just the COVID vaccine, that's any vaccine. There is, I'm not even sure if it's theoretical or if it's clinically proven, that it can stop or it can interfere with Botox working for you at all, even for future dosing. So keep that in mind when you decide to have your Botox. So if you're having your flu vaccine or your update of your booster, no Botox 2 weeks before and no Botox 2 weeks after.
All right.
Okay.
Can you tell me what the reasoning behind not lying down for 4 hours is?
Well, it's really preventative because we have an anticipation of the Botox diffusing approximately 2 centimeters. And I'm speaking for Botox brand specifically in that case. And so if we lie down, we reduce the risk of it possibly moving further. So it can cause the eyes to droop, or it can cause the Botox to go somewhere we didn't want it to go. This is really, really preventative, and most physicians, practitioners will recommend not lying down for 4 hours post-procedural. Now, if I was only doing your crow's feet, sometimes I say don't worry so much. But at the end of the day, you don't want to put pressure on either side of the face until the Botox has absorbed into that muscle.
Okay, awesome. And so one last thing I don't think we touched on is how long will it take for me to notice the difference?
That's a great question. So Botox, this is actually a very important piece of information. Botox can take 10 to 14 days for full effect.
Yes.
You might start noticing its effects at day 3, 4, 5. Everybody's different. For me, it's day 10, but I have patients that start seeing it at day 3. The end point is 14 days. So let's say at day 12, one brow is a little bit higher than the other. Don't call, because we can't touch you up for 14 days because it's still working. 9 out of 10 times it will resolve itself, but if not, a little tiny touch-up is really easy to do. Also, some don'ts. Don't do your Botox more than every 3 months. You can reduce its efficacy and require way more Botox over shorter periods of time because of it. That's where baby Botox does not fit. Once in a blue moon, it won't hurt you. Don't split up your Botox treatments. Don't do your forehead this week and your crow's feet that next week.
Oh, how come?
Because this also can reduce its efficacy. Your body can become immune to the Botox because it can become resistant is actually what can happen. So if you want to treat one area, that is absolutely fine, but wait till you're 12 weeks to treat the next area. Okay.
Good to know.
And I usually recommend people not to do it, but I understand it's based on cost and timing and so on, but these are recommendations. Now, lots of places do it, and I'm not telling you that it's going to destroy your future Botox, but these are clinical studies that show it can reduce efficacy. So if you're in the line of trying to save money, that's not going to do it for you long term.
Okay.
Okay.
Amazing. Am I done?
You are done. Do you see that actually took 4 minutes.
Not long.
It's a
No,
really quick treatment.
Yeah, not long at all.
You
And
should
we
go
were
about a
talking
day.
through
Exactly.
it all. Thank you, Shawn, as always.
Anytime.
I love you.
Thank you. I love you. I love you more.
And that is a wrap on my little Botox journey. I really hope you found it informative and helpful. And a huge, huge thank you to Shawn for agreeing to do this with me. I'll link all of her socials below. And remember, knowledge is key when it comes to any beauty treatment. Is Botox for everybody? I don't know. It's a very personal decision. It's an individual choice for sure, but I do highly recommend that you get a consultation before doing anything. If you have any questions or comments, of course, please do leave them below. If it's something that I cannot answer, I will definitely ask Shawn and she'll provide an answer quickly and swiftly. And believe me, she knows everything about anything, about everything about this process. So leave those comments below. As always, thank you so much for watching. Please do subscribe to my channel if you haven't already. Follow me on Instagram too for lots more over there. And I will see you in the next one, hopefully. Bye.